you hear me? Good evening.
Yeah, good evening, Ben. I can hear you.
Okay, perfect. You're doing a master's in infectious diseases, a master's in public health in the University of California, Berkeley. Would you say this is a perfect timing to be carrying out such studies?
This is pretty unprecedented. What's happening around the world wasn't predicted scientifically. This is pretty new. This kind of took everyone unawares. This is a new disease that we are barely trying to learn. Just to make a little bit definite checklist for definition terms. Coronavirus in general, I'll talk about coronavirus, SARS-CoV-2 and COVID-19. Coronavirus is a whole class of viruses. They cause the common cold, which you and I have probably had multiple times growing up. They are not such a problematic thing. The common cold comes and goes. They are called coronaviruses because they have a characteristic crown, when you look at the membrane under the microscope. So SARS-CoV-2, which is the nomenclature for this new virus, is a new kind of coronavirus that has emerged in China, and that's causing a lot of devastation across the world. So it's the virus that causes the disease called COVID-19. So COVID-19 is coronavirus disease 19 because it was identified, it was discovered, or it started it was the end of December 2019. So this is something that is relatively new and that we are learning about it. But to answer your question, I think this is an ideal time for emergency preparedness. This is an important time to study a lot about pandemics, because we might be observing more and more of these kinds of infectious or these kinds of emerging infectious diseases with time because of the increase in urbanization. More than 50% of Africa is beginning to get more and more urbanized. Most people live in cities, and etc. Agricultural practices are changing. The way humans are interacting more and more with animals is evolving. So we shouldn't be surprised that more of these kinds of zoonotic diseases, that is, these viruses that don't cause problems in animals, will begin to spill over into humans and causing devastation, kind of devastating effects. Coronavirus, SARS-CoV-2 doesn't cause any problem in a bat. Like if you put it in a bat, it doesn't cause any problem. I read some studies about this new virus in dogs and cats. They don't cause disease in those animals. They are problematic in animals and in humans. So we are going to be seeing these kinds of things emerging. So this was like a wake-up call for us to kind of gear up and to build maybe our research infrastructure and things like that.
The virus has been existing from every indication. Coronavirus has been existing. What is new is actually the human strain, if you care.
Yeah, the coronavirus has been existing for a very long time. There's, like I said, but they haven't really caused a lot of problems. Most of the time, because mild disease. We had an outbreak of coronavirus. We had an outbreak of SARS in 2002, 2003, which was severe acute respiratory syndrome, which kind of posed a little bit a problem at the time in China, where it started in Guangdong. We had MERS in 2013, 2014. So we've been observing kind of increase or outbreaks in these certain kinds of diseases. But the question is, what is unique and what is distinct about this particular strain? What we don't understand, even in at the scientific level, at this level, what we don't understand is why this particular disease has an ability to cause both mild disease and severe disease. No one can give you the answer to that question, right? It's a very complicated question that the entire world is trying to figure out. Why do some coronaviruses cause mild disease and why do some cause severe disease? The other coronaviruses that cause the common cold, it's not a problem. You develop immunity and it goes. One thing that was unique about MERS and SARS is they caused uniquely severe disease. They didn't cause mild disease. But this particular disease causes a combination, and you can't tell if you're going to have...
What kind exactly is going to be severe or mild?
you can be infected right now as you're talking to me, but you don't even know you're infected because maybe you could be asymptomatic, and be an asymptomatic carrier, could have my disease and you don't even realize it. But this disease has a unique ability to cause my disease and severe disease. Now the question is, what drives this? Why is it able to do this? So to answer that question, we have to look fundamentally at it's about how the virus infects the cell, how it gets inside the cell, and what it does once it's inside the cell. That's what distinguishes between the mild response and a severe response. And that's what distinguishes this virus from all the other strains of coronaviruses that we've probably known.
We have hardly seen the medical corps this challenged. They don't seem to have any approved treatment as of yet. What do they do then when patients come to hospital? What treatment do they give them? How do they care for them?
So again, this is a big challenge for everyone because there's no approved therapy for coronavirus. There are two kinds of patients that present with coronavirus. That people will present with a mild disease. Oh, I have a mild fever. I have a mild cough. But there are others that will present with other kind of critical conditions like desaturation of the oxygen levels, the breathlessness problems. People will come with end organ failures and things like that. So how these different categories of patients are treated varies depending on what class. So there's basically three classifications. There are those who have mild disease, there are those who have severe disease, and there are those who have critical disease. Those who are mild, well, you want to just do supportive therapy. If they have a fever, you might want to give them paracetamol. So the care is essentially supportive. Those who have severe disease and critical illness, those who need oxygen therapy, oh yes, you want to give them oxygen therapy. There's no approved treatment for there's no approved treatment for this SARS-CoV-2. There's been a lot of excitement around chloroquine and hydroxychloroquine and azithromycin as a combined therapy. And that's because there's a study from France that indicated that there could be some promise in curbing the chains of transmission using hydroxychloroquine and azithromycin. But again, what you see in the lab or what you see in animal models doesn't always translate into human population. You can see something in the test tube, but that doesn't always translate into human life. And again, the study from France had kind of a lot of limitation. This wasn't a randomized controlled study. This was a non-randomized trial. Ideally, we want to do what we call a randomized, placebo, double-blinded controlled clinical trial. That's not what they did. And they had a very small sample size. They only worked on 20 patients.
Yeah, but there are lots of conspiracy theories, especially online, that pharmaceutical companies think chloroquine would be a quick fix and that they wouldn't necessarily make huge benefits from this therapy. And people are like, okay, if people are sick and it works, why not use it? So what does it take normally to approve treatment in such a situation? And why do you think people who are desperate shouldn't use chloroquine?
Yeah, actually, from my previous experience with malaria, as you may know, I did a little bit of work with Professor Rose Lequer with malaria research. I'm kind of chloroquine is an amazing medication. It's awesome. It's been used historically for malaria. It's currently being used for lupus or rheumatoid arthritis. It's an excellent medication. But here we are trying to use it, and it has been approved for malaria. It has been approved for rheumatoid arthritis. Here we are using it for a totally new indication. It has never been tested in COVID-19 before. This is a totally new thing. And you want to go through a normal process to assess if the safety level of this virus, the therapeutic dose. The problem with chloroquine is it has a very narrow therapeutic window. That is the dose between the therapeutic dose, the difference between the therapeutic dose and the toxicity dose is very narrow. You need to have ECG monitoring all through because it causes destabilization of the QT prolongation interval and all that. And so you probably want to measure the patient's potassium level over time, and we don't have the infrastructure to do that in Cameroon. I'm very skeptical.
You're talking about treatment and side effects.
Yes. It's disastrous because you want to be able to do a large-scale study to assess safety of a disease, of a drug before you put it out in the public. Even if you did a phase 1 study which showed that it could work, what works in phase 1 doesn't always work in phase 3. So we are very careful. So there's no approved study that's proven that chloroquine works. I'm very skeptical about that. I recently read a paper that people have been intoxicated with hydroxychloroquine, and I'm not surprised. In Indiana and in other places in the world, which is crazy because people are, intoxicating, taking all this medication. And that's not only chloroquine. There's been other studies looking at lopinavir, which is an antiviral, ritonavir, an anti-HIV medication. There are several others. Remdesivir, as you are aware, I'm sponsored by Gilead Sciences, which is one of the pharmaceutical companies that's developing remdesivir. Remdesivir is one of the most promising therapies against coronavirus. You don't hear a lot about remdesivir. Well, you don't hear a lot of excitement around it because what we are doing in our clinical trial is a double-blinded study. So the investigator giving the patient the drug doesn't know if he's giving the patient remdesivir or not. And the patient receiving the drug, the investigation drug, doesn't know because it's double-blinded. And the patients are randomized.
What is the advantage of this approach?
So ideally, when you want to do a clinical trial, you want to investigate whether it's a vaccine, whether it's a new drug, whether it's a diagnostic test. Ideally, what you want to do is a randomized, controlled, placebo-controlled, double-blinded study. So this is what it means. Randomized means that you have ramshackled the population. You have not chosen a specific group of people, because if you choose a specific group of people, that will be introducing bias. So you don't want to choose a specific group of people. You want to randomize the sample and choose people randomly. You want to separate the sample into two. You want to divide it into two, and in one group, you want to give them your intervention, what you're testing. And in one other group, you want to give them a control, something that's not the drug, that looks like the drug, but it's not the drug. And you don't want the person giving the intervention or giving the treatment to know whether he's giving the treatment to the patient. And you don't want the patient to know, because the patient themselves, those who are doing the clinical trial, if I'm a patient, I wouldn't want to be tested on a drug that's the placebo. I don't want that. And also, as a person who is running the intervention, if I'm giving you the trial drug, I might pay more attention to those who are receiving my intervention than those who are not receiving my intervention. And that might introduce bias. So there may be other factors that account for pre-recall in your intervention group compared to your placebo group. So you don't want that. So you want it to be double-blinded. So you don't know who is receiving your intervention, and you don't know who is receiving your control. And you want to assess the outcome after some time. That's ideally how a clinical trial should be run. And that's not what was done in France. What he did was a clinical trial, but it wasn't randomized. This is something
Dr. Bryan, this will likely take forever to go through these processes which you're listing, whereas the world is actually facing an emergency.
Yeah, remdesivir, the chair of Gilead Sciences, the company that I said is sponsoring me, the clinical trial from remdesivir will be out in a couple of weeks. He announced last week that it's going to be out. It took us like 4 weeks to do that trial in China, in Nebraska, in a few other places around the world. It doesn't take that long, but you want quality data. You want to make decisions based on facts, based on evidence. You don't want to rush. Sometimes not doing something is better than actually doing something and actually killing the patient.
Okay,
so you want to be careful about that. But just to cut, the FDA has really streamlined. Right now, all the attention is driven towards fast tracking. Like FDA has fast tracked development of therapies for for SARS-CoV-2, for diagnostics and etc. So all the long paperwork and all the avalanche of procedures that you have to go through to get approval for a new therapy has been streamlined by the FDA and by the CDC. You can't skip certain stages of a clinical trial.
Okay.
You want to be sure that something is safe before it goes into a population.
Like someone who is doing infectious diseases, what do you make of the response on the African continent so far and especially Cameroon, where you come from?
Yeah, that's a really great question. Because of our context in which we are, I think the measures that the Cameroon government has taken, based on the resources that they have, I think that they are fairly okay. I think it would have been important to have restricted traveling into the country and outside of the country pretty early than we began to do it. I think it would have been important to increase diagnostic capacity in different regions, not only in Yaoundé. Right now, it's all centralized in Centre Pasteur. I wish this could be done earlier and quicker in places like Douala and Bafoussam and stuff like that. The screening that they were doing at the airport, checking people's temperatures and all that is great, but you're going to miss a lot of asymptomatic cases when you do that, right? But I think the most important thing that the government of Cameroon can do is social distancing. Well, we call it social distancing, but it's actually physical distancing, because you cannot get this virus unless you're in direct contact with someone that's infected. So if you do physical distancing, you spread out the population, and that's the easiest way to curb the transmission chains of this virus. And again, that just reminds me of one other big unanswered question that's in the scientific community, is about how much of environmental contamination is driving the chains of transmission. For example, when you go to a grocery store to buy oranges or to buy apples, and someone may be infected, or someone who is infectious may have touched that apple, and then you get that apple and you take it home. Maybe you might not clean it well and you eat it. But how much of environmental contamination is actually driving the chains of transmission? That's an unanswered question right now. We don't know. Mm-hmm. We know that the easiest way this virus gets from one person to another is by physical contact. Either when I'm talking, I'm releasing droplets into the air. When I'm yawning, when I'm coughing, when I'm sneezing, I release these small, tiny particles that loop around in the air. And if you are within 2 meters distance of me, you could inhale these particles, or you could drop on your hands, and in the course of hand gestures and all that, you can touch your eyes, you can touch your nose, and you can touch your mouth, and that's how the virus is propagated from one person to another.
Well, I know many public health officials will argue, officials in Cameroon will argue that the testing now is more wide-scale than it used to be a week or so ago, and that they're now running this test in other towns, notably Douala and Bafoussam, which is the direction to go, according to what you said a while ago. But the other issue also that they are facing, and I imagine the whole world is facing, is the protection of medical workers. Is the medical corps surprised by this kind of infection? And are they not equipped or sufficiently trained to deal with it? What's happening?
Yeah, I think the question about healthcare workers is a really important one. These are the people that are taking care of us, and healthcare workers in general are always at the highest risk. They are the most vulnerable population because they are in direct contact with infectious secretions coming from patients when they're taking care of patients and stuff like that. So it's critically important to have the PPEs, the personal protection equipment, be they masks, be they gloves, be they cuffs, be they head masks, be they gowns and all that. It's absolutely vital to protect the healthcare workers. So we definitely need an overrange of those kinds of equipments for our own healthcare workers. But also, I think many of our healthcare workers haven't been trained to take care of patients that have these kinds of diseases that are highly infectious, that can easily be transmitted from one person to another. We've not been sufficiently trained in terms of pandemic response to deal with these kinds of pandemics. So I wouldn't be surprised that we would. This is something that's critically important. I think this pandemic has highlighted many of our vulnerabilities as a society, many of our weaknesses, many of our unpreparedness in terms of pandemic response. So I think all governments across the world have seen how vulnerable we all are in facing these things. And I think that there's going to be great need moving forward to increase capacity in different healthcare settings to be able to deal with these kinds of epidemics in the future.
Well, thank you very much, Dr. Bryan Tegomoh, for your insight. You are a specialist in infectious diseases, and you've carried out lots of research on malaria here in Cameroon before moving over to California, where you're currently studying. Thanks for your insight. We look forward to talking with you again anytime soon if the situation warrants it.
Yeah, thank you so much. It's such a pleasure to talk to you.
Thank you. Have a nice day.
Yeah, thank you.